Hello, this is Angela Gartner, editor at Northeast Ohio Parent Magazine, and welcome to our 2023 Summer Safety Talk Series. We are with Heather Trnka. She is the Injury Prevention Supervisor at Akron Children's Hospital. Welcome, Heather. Thank you for joining us.
Thanks for having me, Angela.
Today this is actually part 3 in the series, and we're going to discuss heat safety and how to protect your family from the rays. Well, first, while we're here in Northeast Ohio, we are so excited to see the sun. However, we want to make sure families are protecting themselves. So, Heather, tell us a little bit how families can protect themselves from the sun's rays.
Thanks, Angela. I'm happy to talk about sun safety. It's important in Northeast Ohio. Although our sunny days are sometimes limited, it's important to make sure we're protecting our children and ourselves from the sun. And so there's some important things that families can do to keep themselves safe. A lot of that is staying out of the sun, finding shade, wearing sun repelling clothing. They make so many really great clothing with UPF protection. And also applying sunscreen. And sunscreen is great for those kiddos ages 6 months and up. We want to make sure that sunscreen is paraben free. And anywhere between SPF 30 and 50 are adequate enough to protect us for 40 to 80 minutes here in Northeast Ohio. Now, when we're down at the beach where the sun's a little stronger and a little brighter, we might need a little more protection and stick around that SPF 50.
Well, and I mean, heat and humidity is really big in Northeast Ohio, right? And talking specifically about infants, like how can parents make sure infants are not overheating while in their strollers and then also during outings or even at home?
We want to make sure, especially with our littlest babies, that they are dressed appropriately. So, however you're dressed is appropriate dress for your infant as well. So we don't need lots of layers. Be cautious about blankets. Car seats can get really hot, especially out in the sun. If we've got one of the car seats that click into the stroller, we want to make sure that we're picking our babies up, giving them making sure that there is access to a breeze, letting their bodies cool, because they don't cool as quickly as what we do, and they can overheat very quickly. So we want to make sure that we are keeping them cool, giving them opportunities and breaks from the stroller, and just checking in on them, making sure they're not overheating.
Can you talk about safety in regards to blankets over the strollers, especially we tend to do that a lot of times in winter to kind of keep them safe, but what should we do to kind of keep them safe in the summer when we're taking them out?
And for our little kids who can't wear sunscreen or shouldn't be wearing sunscreen yet, we oftentimes use a thin blanket over our infant carriers or over the strollers. And what that can do is decrease the amount of airflow that the baby is getting. Now, not dangerous enough that they're going to stop breathing, but enough that they might have trouble cooling themselves. So we want to make sure that if we are doing that, we're out in the sun, that we are checking on them regularly and making sure that they're not overheating.
Talking about older kids, many of them are doing sports and activities and they're outdoors. How do we keep them really from have getting overheated, having heat stroke, and making sure that they're really staying hydrated?
It's really important that we're making sure that our kids are drinking enough water. For our little kids, about 4 ounces every 20 minutes. For our big kids, about 6 to 8 ounces of water. So not a ton of water to stay properly hydrated, but it's important that that interval is paid attention to, that we're making sure that they are taking breaks, they're getting water breaks, that they're drinking water is fine. We don't need sports drinks. We don't need juice. Just straight water is what's best. And especially for our small little athletes as they're out in the soccer fields and the baseball fields this summer, that they're getting that chance to have a water break.
Is there any like first aid that, we can kind of carry to kind of help prevent sunburn and water? And then what happens if we do get sunburn? Like how
Yeah.
can we go ahead and treat that?
So let's start with sunburns. So if sunburns that are blistered, you might want to seek some medical attention for that because we're kind of in that danger zone. So we don't pop blisters anymore. If a child has a sunburn that is severe enough that it's caused a blister, it might result in a trip to a pediatrician. But we want to make sure you can use aloe, but we want to be conscientious that we're not using aloe that has lidocaine in that for our littlest kids because it can cause a lidocaine poisoning in them. So just straight aloe or a moisturizer over that burn, whatever makes it feel comfortable. A room temperature shower might make them feel better. It's just kind of dealing with what might make them more comfortable. Sometimes an over-the-counter pain reliever might be needed as well if that burn is really painful for them. And when it comes to heat related injuries, we want to make sure that if our kids are showing confusion, loss of consciousness, that's a medical emergency. We need to get them to the hospital straight away because they're going to need some advanced cooling more than you can just do with a bottle of water.
Well, we would like to thank Heather for joining us today and look for more tips and view the whole 2023 Summer Safety Talk series at northeastohioparent.com. To learn more about Akron Children's Hospital, visit akronchildrens.org. Thank you for listening.